Good afternoon. I'm speaking to you from Sydney. Unfortunately, my sincere apologies for being unable to be there today. Unfortunately, parental commitments meant that I couldn't travel in time to get back to Colombo. So what I'm going to talk about today, I'm going to talk about the crisis. I think when the college originally approached me, they wanted me to talk about health economics, but I thought given the gravity of the situation in the country, it was best that I share my views, my perspective, both as an economist as well as a public health physician, on the challenges we face, how we ended up in this mess, and what our role is as physicians and as healthcare professionals to respond to this challenge. So let me first start with two misconceptions which I want to deal with and get out of the way. These misconceptions I occasionally hear from other physicians, but also from other people, but it's something we should be fairly clear about, and that is whether Sri Lanka's health system is really a performer, a positive performer. And all the research that I've done over the past 30 years, looking at it in many different ways, always concludes that Sri Lanka is an extreme positive outperformer compared to other developing countries and even compared to other developed countries. And this is not something that Sri Lanka has been doing in the past. It's something that continues to be the case today. And these are just numbers just to make that point. They compare Sri Lanka with Thailand, Turkey, Mexico, and Japan. If you read The Lancet, if you read many global health journals, these are the countries that are usually mentioned as the role models for universal healthcare coverage. And I put USA in there as an example of a wealthy country. It's a country with a dysfunctional health system, but has a lot of money, and you can compare how well we do with them. And the main point is that compared even with these UHC superstars, Sri Lanka does incredibly well. In fact, it does often much better. And we do so with much less resources. We have a lower GDP per capita, so we're poorer. Our total health spending is less. We only spend around 3% of GDP compared to 4 or 5% in those other countries. Our government health spending is really, really low. It's less than 2% of GDP. In all these other countries, it's 3 to 4% up. And despite that, we have very high levels of healthcare coverage, whether it's curative services or preventative services. Even on a simple metric, such as how many times people get to see a doctor, Sri Lankans go to the doctor 6 to 7 times a year, typically. This is higher than most other developing countries. It's higher than in Mexico. It's higher than in Thailand. And in fact, it's higher than in the United States. And that high level of healthcare consumption is associated with very good healthcare outcomes. Our infant mortality rate is very low by international standards. Our life expectancy is very high. Now, the second misconception I want to deal with is that this performance is simply something inherent to our climate, our environment, our culture, our society. That's not true. If you go back 100 years to the 1920s, it turns out Sri Lanka was probably the sickest or most unhealthy place to live in South Asia and Southeast Asia. Compared to the rest of the British Raj, we had much lower life expectancy, much higher mortality rates, and even compared to the rest of Southeast Asia, for which we have data. Let's give Thailand as an example. And yet 100 years later, that's today, we have health outcomes better than the rest of South Asia and comparable to the best performing countries in Southeast Asia, which are essentially Thailand, Malaysia, and Vietnam. Now the question is, why did this happen and how did this happen? Well, the answer to why is very simple. It was democracy. It's the fact that Sri Lankans have elected their governments who've set health policy ever since the 1930s. Now, I want to make a couple of comments about the how. Why did we end up being a democracy in 1931, where we essentially voted for our own governments, with women having the vote? This was because of the decisions or recommendations of the Donald Commission, which recommended that women should have the vote and recommended that executive power should be transferred from London, from the colonial office, to an elected government in Colombo. Now, why did they do this? They felt that the only way to improve social conditions in Sri Lanka was to ensure that governments in Sri Lanka were accountable to Sri Lankans and not accountable to London. Worth emphasizing that because today, I see a lot of calls in the international community asking for Sri Lankans or Sri Lankan government to be accountable to, again, to people in London or people in rich countries. The colonial reformers who came here in the 1920s thought that was a really bad idea. It wasn't the way to go. And they were proved right over time. The other thing is the consequence of electing governments. Well, after we elected the first legislature on the basis of universal franchise in 1931, there were very immediate changes in social policy. There was increases in taxation, that's fiscal policy. Income tax was introduced for the first time in 1932, and there was increased spending on health, education, and other forms of social provision. And that led to a vast expansion in healthcare facilities, which made healthcare access genuinely available to most Sri Lankans. Now, the political system didn't just give birth to the healthcare system, it's shaped the healthcare system. And it's done one very important thing. Since the 1960s, we haven't had sufficient money to continue expanding the healthcare services. In fact, government spending on healthcare in the 1960s was around 3% of GDP. It's now less than 2%. There's actually been a decline in government spending as a share of national income in the past half century. And what the political system has had to do is to balance the desire of most Sri Lankans for more healthcare and also a willingness to pay higher taxes for it with the unwillingness of the better off, the richest 20% in Sri Lankan society, to pay higher taxes. The other thing it's done is it's forced the public sector and doctors to expand service delivery largely through efficiency gains and not through additional resources. That, unfortunately, hasn't been enough. There still hasn't been enough money, even with efficiency gains, to provide services to everyone. And so what our system does is that it segments provision between the public and private sector. And in the public sector, non-clinical quality, things like choice of doctors, how much time you spend with a doctor, etc., those have been rationed. And that's been implicitly used to encourage the better off to opt for private care, which they pay for themselves. Now, even that's not been enough. There has been shortfalls in funding, particularly for medicines and diagnostics, despite that, and that has affected the healthcare system at its margin. Now, you can see this in two ways. This is some data from the Sri Lanka Health and Aiding Study 2019 survey, which IHP and my institution does with 4 other local universities. And you can see there's a high percentage of people with diabetes who have never been diagnosed, around 40%. And then if you look at people with diabetes who are actually on treatment, less than half are currently under control. And I think part of this relates to inadequate funding for medicines and also inadequate funding for diagnostics. Now, the other example I want to talk about how this has affected the operations of the healthcare system is COVID. You all know that we started the pandemic with a much better response than most countries in the world. We remained largely COVID-free during 2020, but the COVID strategy, which is essentially a zero COVID strategy, if you read the government documents, essentially collapsed in early 2021. Now, why did this happen? It wasn't a fault of the healthcare system per se. Kind of things that we needed to do to keep COVID at a low level until we were fully vaccinated, the things that countries like Australia, New Zealand, Taiwan, China, Thailand did, the kinds of things that they did, we did quite well. So that's essentially, we had tight border security, and must thank the military for that. We had very effective contact tracing and isolation. Again, thank the public health workforce for this. But we failed to prevent large outbreaks. And the reason we failed to prevent large outbreaks was that we failed to build up community testing to detect new outbreaks during 2020. If you look at the New Zealand and Australian strategies, they understood this very early on, and they invested through 2020 in expanding testing. And this on the left, I have some of the papers which came out in New Zealand describing their strategy, and it was that component, the testing part, that we did not do. Interestingly, the testing component in the New Zealand strategy and eventually the Australian strategy, and I show you the relevant text, it's actually the first part of that text if you read the article, comes from research done by a Sri Lankan Australian, Dr. Carmen Nokige at the Australian National University, who essentially showed that the only way Australia could keep itself free of new COVID outbreaks until vaccination occurred was through very high levels of testing. Now, why did we do this high levels of testing? I think it reflects the cost constraints in our healthcare system. Our doctors are very used to being economical in the use of tests. We have a culture against testing, and there wasn't enough money in the treasury, people thought, to pay for the testing. Now, I want to turn back to the current crisis. Now, the first thing to say about the current crisis, it's not the consequence of COVID. It is primarily an economic crisis due to failed economic policies. And to put it very simply, we're bankrupt. And there are two separate crises. There's a fiscal crisis, and that means that the Treasury doesn't have enough cash to pay for basic expenses, to pay for salaries or pensions, health and education, poverty transfers such as Samruddhi, or even energy subsidies. Simply out of money. The only way it's surviving and paying your salaries if you work in the public sector is because the central bank continues to print money to pay for some of those things. The second crisis we have is that we're short of foreign exchange. But we have no foreign exchange. We lack dollars to pay for imports, and we also lack dollars to pay our foreign debts. And in fact, we stopped paying our debts for the past 6 months. And as a consequence, nobody in the world will lend us dollars anymore. So we have a foreign exchange crisis, and we're essentially bankrupt in dollars. Now, these two things are somewhat separate, but they are linked. The reason we have a foreign exchange crisis, one of the main reasons for this, is that because Treasury lacked cash previously to pay for things, we borrowed internationally, and we built up essentially a huge debt in dollars in overseas. Essentially, we used our overseas international debt credit card to pay for stuff in Sri Lanka. And essentially what's happened is that we've maxed out our credit limits, and nobody will now lend us anymore. Now, why are we in this fiscal crisis? I'm going to try and simplify the current crisis wearing my economist hat for you. The answer is very simple. It's because we tax too little. And it's not that we spend too much as a government or as a public sector. This is something I want to repeat. We tax too little, and the problem is not that we spend too much. Needs to be understood, needs to be repeated, because if I read the media and if I listen to politicians, many of them still don't understand this. Now, I want to talk about taxation in Sri Lanka and explain how we got into this, how we are, in fact, a low tax country and how we got there. This is data from a report the Asian Development Bank did just back in 2016. So it was during the previous administration of Ranan when he was Prime Minister. And it shows you the gray squares here is the relationship between general government taxation levels and income levels across the world over the past 30, 40 years. And you can see the black line, essentially as countries become richer, they tax more. They tax a greater share of national income. So development, capitalist market development, is associated with increasing tax rates in the economy. Now, if you go and look where Sri Lanka was in 1990, our tax collection was around 22% of GDP. It was a bit higher than average, but it's pretty typical for a country at our income level. But what happened in the subsequent 30 years is that we cut taxes aggressively decade after decade. And by 2015, our tax collection had fallen to around 13% of GDP. This was pretty much at the bottom of the range for developing countries at our income level. You can see that we're at the bottom of the gray pack there. And at that point, the World Bank, the IMF, the ADB, pretty much anyone who had any expertise on the matter was warning us that we needed to increase taxation. Well, we didn't. We did have an IMF program under the previous round of Wickremesinghe administration, but even after the IMF program, taxes had fallen by 2019 to 12.6% of GDP. And then in 2019-2020, under the incoming administration, there were substantial tax cuts, which resulted in tax collection falling to below 9%. And at this point, we have one of the lowest rates of tax collection in the world. In fact, most countries in sub-Saharan Africa, almost all countries in Asia, collect more taxes than us. Now, it's not just taxes in general. We collect far less income taxes, corporate taxes, and VATs than our peers. This is a chart from a recent ADB report. It shows you the overall tax collection in other Asian countries and the composition of those taxes by type of tax. Because Sri Lanka, this chart was based on data up to 2019. If we did this chart today, Sri Lanka would be at the right of the end, at the right-hand side, because our tax collection has fallen even further. But if you look at the red part, that's personal income tax. We collect far less personal income tax than other Asian developing countries. And if you look at the gray part, which is corporate income tax, we collect far less corporate income tax. And even VAT, which is the blue bit, is again substantially less than other developing Asian countries. Now, just to give you another perspective on these low rates of taxation and how bad things are, other developing countries in Asia at our income level are probably collecting 30% of their national income taxation. In 1990, we collected around 22%. By the time that the last Ranil Wickremesinghe administration came into office, we were collecting 13%. By the time they left office, it had fallen to 12.6%, and now we're collecting around 9%. What it means is that we're collecting 1/3 of the taxes in Sri Lanka that other Asian developing countries are collecting at our income level. So if we want to get back to being a typical Asian developing country, typical Asian developing countries are able to reduce poverty, they're improving their health standards, they're growing their incomes, they're doing very well in general. If we wanted to get back to tax rates comparable with them, we would have to triple tax collection. Now, there's been a consequence for this reduction in tax collection over the years. We've been cutting spending. And we've been cutting spending, the government or public sector has been cutting spending for about 30, 40 years. And there's, as a consequence, also been no increase in health spending. I mentioned that to you earlier. This is a chart from the same AD report done a few years ago, and it shows that total government spending has fallen from 30% in the 1990s to around 20% today. And as again, these great odds are for other countries, you can see that Sri Lanka spends far less than other developing countries and far less than the average developing country at our income level. So the Sri Lankan government is a low spender. It's not a high spender. Whatever you think, it is a low spender. And the consequences you can see in the red chart, it's meant that health spending has essentially been flat for 30 years. Now, in response to the crisis, as you all know, we are negotiating with the IMF, and I want to just say a few words about why we have no choice as a country but to come to some agreement with the International Monetary Fund. And the essential reason is this: unless we get an agreement with the IMF, nobody else in the rest of the world will lend us dollars. And without dollars, our economy and our health system cannot function. Without dollars, we cannot buy petrol for cars. Without dollars, we cannot import medicines. And if you think you can produce medicines in Sri Lanka, even if we produce medicines in Sri Lanka, we still have to import the active ingredients because we can't make that. It's not feasible to make those in Sri Lanka. So we need dollars for the economy to function and eventually to grow. And the government also needs dollars because it doesn't have enough rupees in its hand to pay for basic services. So unless we get the IMF agreement, nobody's going to lend us dollars again. So we have to get that IMF agreement. Now, what is the IMF asking us to do? And I put here on the right, you can look online, it's on the IMF website. This is the public analysis of the Sri Lankan economy by the IMF. It was published in March, and it's the basis for what their discussion with us today. And if you read this, it's very clear what the IMF is asking. The first and most important thing they're asking Sri Lanka to do is to raise taxes substantially. And then they don't say cut, they say rationalize spending. It's an interesting choice of term. And they use that word because in the case of health, education, and poverty transfers, they say that the government, Sri Lanka, needs to raise health spending, needs to raise education spending, even in this crisis. And then the third thing it talks about is reducing energy subsidies and subsidies to parastatals. Now, what the IMF is not asking, because I have to say this because there seems to be a lot of misconception amongst politicians and amongst civil society about this, the IMF does not anywhere in this document demand privatization or even recommend it. It's not asking for mass privatization, and it is not demanding that we cut overall government spending. So if you hear that's what the IMF is saying, well, what you're hearing is wrong. That's not what the IMF is asking. Now, I want to say a few words about how we really got into this mess. And I think there are two broad sets of explanations for this. The first is ideology. And not something, as an economist or even as public health specialist we often talk about, but ideology, beliefs in our political and business and social elites have played a huge role in getting us into this mess that we're in. And I want to just make reference to the recent events in the UK. You all know that Liz Truss ended up being Prime Minister of the UK for only 45 days. And the reason she fell from power, was removed from office essentially, was that she, as one of her first actions in office, she launched a budget which substantially cut taxation in the UK. And the response of the business elite, the response of the political elite, including most of our own political party, the Conservatives, and the response of the social elite, including the heads of the medical profession, was to say this is unacceptable. And it was that response that eventually forced her from office. So in the UK, a country whose tax level is around 40% of GDP, it's about 4 times as much as we collect, reductions in taxation of the scale that she proposed was deemed completely insane and unacceptable. And so there was huge, essentially, social revolt, and she had to resign. Now, compare that with Sri Lanka. In 2019, 2020, we had both political parties run manifestos of tax cuts. We had a tax cut which was comparable in size, and our business elite just moved on. They welcomed it. Our social elite said nothing. Our medical association said nothing. You pair that with the BMA and the colleges in the UK, who all spoke up in favor of higher taxes. The second thing, and the second part of this, is our political system has become incredibly dysfunctional. It was established to represent or respond to the views of Sri Lankans, to balance the needs or preferences of rich and poor, but over the past few decades, it's become captured by the better off in our society. We have data again from the Sri Lanka Health and Ageing Study where we asked people what they wanted the government to increase spending on, and they would tell you health and education. And we're doing that polling even now today. Health is the number one priority for Sri Lankans in terms of increased government health spending. And if you ask them, were they willing to pay taxes, most Sri Lankans are willing to have increased taxes even today to pay for better health and education spending. It's only the richest quintile who are opposed to doing this. And unfortunately, our political system responds to the richest 20% of Sri Lankans. And that's essentially the other reason we are in this mess. So we have a belief in our political elite that low taxes are good, even though it makes no economic sense. And I say that as an economist. And we have a political dysfunction that our democratic system doesn't respond very well anymore to the poorest 80%, the majority of Sri Lankans. So I want to just end with some messages to you. If there's anything I want you to take away from this, from my discussion, essentially 4 things. The first thing is our health system performs well. The work that you do as physicians contributes to better health, and our health system is incredibly cost efficient. It's probably the most cost efficient healthcare system in the world. Secondly, most Sri Lankans, they want higher social spending. They want higher spending on health, and they support higher taxes to pay for it. 3, low taxes are our fundamental economic problem today. If we're going to get out of this mess and lay a sustainable path for economic growth, but also economic growth that provides resources to improve our healthcare system, we need to resolve the problem of low taxes. We cannot continue having an economic policy based on low taxation. We railroad on that particular strategy. And then finally, and this is a very important message to you as physicians, and I say this because I've been dismayed over the past 6 months by the response of senior physicians that I talk to in their unwillingness to ask for higher taxation. And I'm dismayed because if you look at the UK, the British Medical Association, other medical colleges have been willing over the past decade to argue publicly the case for higher taxation to support the NHS. Our doctors have not been willing to do that. Our medical associations, our colleges have been silent. Our unions have been silent. If anything, our doctors are asking for lower taxes right now. That's what I've read in the newspaper in the past 1 week or 2. So I think what I want to say to you, as physicians, we have a moral obligation now, as one of the most respected stakeholders in our society, we have an obligation to argue the case for higher taxes and to demand that politicians deliver higher taxes on a long-term basis to provide the basis for a better society in Sri Lanka and a better healthcare system. And that's a role that you have to play as individual physicians, and the role that the college and other associations and unions in the physician community also have to pay in order to contribute to a better future in Sri Lanka. And I hope that's what you do, but that's essentially my argument for doing that, and I hope that you take that away at the end of this session. Thank you.